When performing a routine exam of the humerus, there are two projections that need to be performed, the AP and the lateral. Let's look at the AP first. Notice the patient position. The hand has been externally rotated, placing the humeral epicondyles parallel to the IR. When centering your central ray, somewhere in the midpoint region of the humerus is a good location to start with. It's important that we include both the proximal and the distal joints of the humerus. Usually you want about an inch to an inch and a half overlap of each joint if possible. Sometimes turning the collimator tube head will help you in getting the entire humerus as needed. Let's look at the image performed. Here we have an AP humerus. Notice this is a left humerus, unlike the picture demonstrating a right. You can notice some obvious pathology in the center or mid-humerus region. But as we look at the humeral epicondyles, despite the pathology, we still have an AP humerus projection. Now let's look at the lateral. The first one, the patient has placed their hand on the side of their hip. This can be somewhat tricky sometimes, trying to get a perfect lateral. The idea, very much like the AP, we want to include both the proximal and distal joints, but we also want to get our epicondyles of the humerus to be perpendicular to the IR. This may require bringing the elbow a little bit away from the IR to get a true lateral position. If you notice in this image, despite a little bit of pathology, we've gotten a pretty good lateral humerus. But if we look at these epicondyles, they're not in a perfect true lateral, and this is some kind of rotation. In this particular image, this is due to the pathology and the fracture. However, we will be looking at the medial lateral projection here in just a few minutes, which will show a good true lateral. Okay, as we're looking at the medial lateral, this is sometimes an easier one to perform for some individuals, and sometimes it could be somewhat of a challenge. As we look at the positioning here, the patient has placed their humerus up against the board and they're facing the board. Now, this is a pretty common projection that you can use if the patient comes in a sling and they already have their elbow kind of flexed at a 90-degree angle. In the process, that this is very similar to a lateral elbow, once you place the patient up against the board, it's important that you bring their arm a little bit away from their body and make sure they turn their thumb out. Turning their thumb out is going to place the radius and ulna in a good true lateral position. Let's look at this x-ray and see what we have here. Okay, looking at this medial lateral projection here, you can see that the epicondyles of the humerus are indeed superimposed over each other, and we have a pretty good lateral humerus in this image. Well, that does it for the most common views for the humerus. Let's move on to the shoulder.